Hi, I'm Kristin. I'm Dr. Francis. I'm a child and adolescent psychiatrist at the University of Utah. I work at the inpatient hospital. Some people might be familiar, having gone there. Some of you may have relatives that have been there. It's a nice place. It's not scary. So if you ever need help, we're there. I love working with young people. I'm an adult psychiatrist as well, but I love working with young people. I especially love working with young people with eating disorders. That's one of my big areas of focus. And as you may know, eating disorder behavior typically starts in adolescence. It's really a disorder of adolescence, and it's not treated by adulthood. It's likely to continue, but if we get in front of it while someone is a child, adolescent, young person, youth, we have an 80% cure rate for anorexia nervosa, which is huge and better than most childhood cancer outcomes, to be totally honest. And we are able to help people live full and meaningful lives. There's also a lot that we work with at the U with suicide, which is really hard for everybody. It's hard for us as providers when we lose a patient. I keep thinking it'll get easier, and it just seems to get harder and harder when I have spent time with a young person and they're not there anymore, when I get a follow-up call. And so tonight I'm here really, you've seen the statistics online, you've seen the rates of depression and anxiety. I don't have to tell you what it's like to be a young person these days, right? And all the different struggles that you're going through that are unique to your generation, that our generation knows nothing about. I have teens, and it's really hard as a parent to not know as much as your kid does when it comes to technology, right? And I pride myself in knowing a lot, and I'm still really behind. So tonight I'm here to help provide some medical opinion for any questions that you might have. I'm also here to tell you that the reason I'm bringing up suicide tonight is that in most states, the biggest cause of death for young people is accidents. And in Utah, we have a unique and unfortunate statistic that the leading cause of death for children and youth is death by suicide. And there's a lot of questions about why that is. I don't know why that is, but I do know that there's a lot of support and there's a lot of help, and we're all here actively trying to reduce that. We're trying to reduce the rates of depression, reduce the impact of anxiety, help people have a meaningful and happy life. And so I'm here tonight to kind of help support any decisions that can lower that statistic, lower the cause of death. I also would like to just offer up that when we ask someone to change behavior, it's really hard to get them to stop doing something. It's much easier to get them to start doing something. And so I would advocate for a reward system for our young people if they're being asked to kind of give up their cell phone use during the day. I would ask that we think about how do we help incentivize that for them? What can they get? And this is a great thing. I think you're young, you need to know the power of negotiation and your voice and your choice. And I think that there's sometimes where adults just make the decisions, and that's the way it is. And there's a lot of times when we can find a middle path and we can work together. I talk to my kids a lot about, like, you want this, I want that. How do we get somewhere in the middle? What do we do? By the way, my kids are really not happy that I'm here tonight. They wanted me to stand up and say cell phones make everyone better. But I really encourage us to think about how do we make this a student-led initiative, if possible. I think that could be really cool. I think that it would really help. I think we as adults can just talk about the statistics all day, but these are the people that it matters to, and these are the people that it's impacting. And I think it's great for young people to have advocacy in their life and to take control of the things that they can, because so much isn't in their control. So just want to put a plug in that we are here at the University of Utah for you. If you need help, there's a lot of people. We have a SafeUT app, as you know, that you can use on your cell phone after school, sounds like. And that's supposed to be funny, but you can use it before school too. But we are here to help you, and I'm here tonight just to support you and totally ask for something if you're being asked to give something up, okay?